Namaste. Good evening, everyone. I'm Dr. Bharti Bhojwani, EC member of IDA Mumbai branch and Maharashtra State branch. We had arranged a few sessions on health this week. So, in continuation with our series of Health Week, I welcome all the participants for a wonderful session on fasting. On behalf of office bearers and EC members of IDA Mumbai branch, I welcome our esteemed speaker, respected Dr. Gopinath Dubey sir, and I'm very thankful to him for giving us this time from his busy schedule. I now welcome our moderator, Dr. Anup Saran Bhojwani, to further continue the program. Thank you.
Hello everyone, very good evening. I'm Dr. Anup Bhojwani. I'm a prosthodontist practicing in Chembur, EC member, IDA branch. Today I have been honored by giving an opportunity to moderate this session conducting by Dr. Gopinath Dubey sir. Sir is an assistant professor in Darbhanga Medical College. Sir was initially having a lot of medical issues. Himself, he has uh, cured with raw vegan diet, and he is sharing his knowledge which he has experienced the benefit of going on a vegan diet, also on a raw diet, and plus the advantages of fasting. So we are very enthusiastic to know about your knowledge and your experience, how you have achieved so much that today you're completely medicine free, and you have been able to cure your spondylitis and irritable bowel syndrome, bronchial asthma, and migraine. So as a dentist, most of us are having many back issues. So we are very much enthusiastic about knowing how can a diet and how can fasting cure our illness, and we can, feel very much energetic. Thank you so much, sir, for joining our session. Over to you, sir.
Thank you. Thank you, Anup Saran Bhojwani, for introducing me. And I would like to thank Dr. Bharti Bhojwani and IDA Mumbai. They have invited me to talk on the very important topic on fasting. I would like to thanks again IDA Mumbai who have given me opportunity to talk about this topic on this platform, as it would be helpful for many of us. Recently, in 2016, Yoshinori Osumi has got Nobel Prize in 2016 for fasting for health and slow down the aging. That is for longevity. He got Nobel Prize for the same. And in India, we are knowing this from ages. The different kind of fasting, like in different cultures, we practice fasting. So fasting is very much helpful for health and for longevity as well. So I will talk on fasting. There are various types of fasting, but I will not talk on detail. The short-term fasting from 16 hours to 72 hours, and what physiology goes on in our body and how it helps us. So when you start fasting, up to 12 hours in your body, there is an increase in growth hormone. And growth hormone is very important for your skeletal muscles and bone health. And we all know exercise, physical activity also increases the growth hormone. As you goes on and you continue it for 14 hours fasting, growth hormone goes on increasing and your fat burning starts. Without any physical activity, fat starts burning. And very important things, if you goes on fasting for 14 hours, there is increase in insulin sensitivity. Those persons who are having pre-diabetes or insulin resistance. So there is increase in insulin sensitivity. If anyone fasts for 14 hours every day, an eating window of 10 hours, so he and she is increasing his insulin or her insulin sensitivity. If anyone goes on fasting for 16 hours, fat burning further increases. If you goes on fasting for 18 hours, there is increase in autophagy. And this autophagy, that is those cells who are already damaged, wear and tear cells, that body uses up for energy. So there is autophagy and there is decrease in advanced glycosylated end products that is called AGES. And we all know in diabetes, whatever microvascular and macrovascular complications occurs, these are all due to advanced glycosylated end products. This atherosclerosis, CVA, that is cerebrovascular accident, coronary artery disease, retinopathy, neuropathy, peripheral neuropathy, and peripheral artery disease, that are all due to advanced glycosylated end products. So there is decrease in advanced glycosylated end product if anyone continues to fast for 18 hours and more. And that decrease in amyloids, this is a protein which are deposited in the brain and causes many pathology. And an important one is Alzheimer's disease. So you are decreasing the risk of Alzheimer's disease if you do fasting up to 18 hours and more. And in 18 hours fasting, there is increase in ketone bodies in your body. Here, body starts using ketone for energy. That is, there is a lipolysis and formation of ketones, keto acids, and they are used up for energy generation. If you goes on fasting for 24 hours, what happens? The all glycogens stored in the liver, depending upon the weight, we can store up to 50 to 100 gram of glycogen are in our liver, and that all are depleted. If you continue, goes on continuing 24-hour fast, you deplete almost all glycogen from your liver. And at this time, inflammatory markers starts waning. There is decrease in inflammation. Your gut starts healing. Whatever leaky guts, there is multiple micropores formed in the gut that starts healing. And all autoimmune disease, and even I can say whatever diseases of the mankind, the seat anchor is leaky gut syndrome. So if you do fast once in a week for 24 hours and more, you are going to heal your leaky gut. And there is decrease in the risk of SIBO, that is called a small intestine bacterial overgrowth. Many patients we encounter gas, bloating, gurgling abdomens, flatus. These are all due to SIBO, small intestine bacterial overgrowth syndrome. So we are going to decrease the risk of SIBO. And if you continue on 20 or 24-hour fasting, you increase your stem cells. And we all know we are blessed with stem cells, which can differentiate into any kind of cell. And where there is a pathology or damage, that stem cells goes there and it starts repairing. And it is helpful for your heart, for brain. In brain, there is release of BDNF, that is called brain-derived neurotrophic factor, which is important for your neuronal survival and its growth, as well as repair. And there's formation of even new brain cells. This is the new things that has come up, as we know, since our childhood. Whatever brain cells has already formed, there is no formation of new brain cells, but some scientific facts are coming up. This BDNF, brain-derived neurotrophic factor, and yes, it is also responsible for neuroplasticity. The memory and the new learning things are all due to this BDNF. So if you continue fasting for 24 hours, you increases your this BDNF, brain-derived neurotropic factors. If you continue on fasting for 20, 40, and 36 hours further, there is increase in autophagy by 300%. 300%. If anyone fasts for 48 hours, you are going to increase autophagy by 300%. So whatever damaged cells, pathological cells are there, they are going up to used up for energy for your body. And if you continue 48 fast, then there is increase in autophagy, increase in stem cells, undifferentiated stem cells. Undifferentiated, they are not differentiated, they are going to differentiate wherever there is damage, be it your skeletal muscles or bone or heart or kidneys or liver, whatever, wherever, it is going to heal it. And the risk of, it decreases the risk of cancer and tumor, Further, it increases the powerhouse of the cell, that is called mitochondria. Immune systems are resets and cellular regeneration starts. At 48-hour, regenerations with the help of stem cells starts, and there is marked decrease in inflammatory mediators. If you goes on fasting for 72 hours, it further increases your stem cells by manyfold, and there is increase in immune functions. And at this time, your autophagy maxes out. That means from further here, there is no benefit of autophagy. So I usually suggest to go for fasting 1 to 3 days, not more than that. If you do it for fortnightly, every 15 days or in a month, you are going to get many health benefits out of it. And if you continue goes on fasting, intermittent fasting, 14 to 16 hours, and you are going to keep your eating window for 8 to 10 hours, it is going to give you for a health benefit like anything. This is all for my sides. And this is about the fasting. And one more important topic I would like to cover. Nowadays, no one knows what is good for our health. Okay, how much I should eat, how much calorie my body needs. That very important topic that I am talking about. How we can lose our weight. If I am skinny, then how we can put on weight. That all things I am going to discuss in continuation with the fasting the topic. What should be the ideal weight for us? What should be the ideal weight? We must know if you are a health freak, we want to remain healthy till our last breath, we should know all these facts. So there is one important formula, very easy formula. Anyone can calculate what should be his or her ideal weight. That is Broca's index, and it is height in centimeter minus 100. Per se, you are 170 centimeter, your height is minus 100. So your weight should be 70 kg. It should not be more than that. If you are more than that, that means it is difficult. It is going to harm your body. You are going to lose your health. So that should be the ideal weight. If you are a diabetic or pre-diabetic, then whatever it comes multiplied by 0.9, that should be your ideal weight, plus minus 3 kg. Plus minus 3 kg. But say your height is 170 centimeter, minus 100, it comes 70 kg. If you are a diabetic or pre-diabetic, multiplied by 0.9, that comes 63 kg. And what I said, plus minus 3 kg. It can be kept up to 60 kg, up to 66 kg. If you are in between 60 to 66 kg, it's okay, fine. A very important information that we must know, since we are right now diabetic capital of the world, and right now 100.4 billion people, that is 10 crore people in India, are diabetic, and 136 million, that is 13 crore 60 lakh people are pre-diabetic. So in upcoming 5 years, we will have 23 crore 60 lakh people will be diabetic in our India. So every 7th person will be diabetic. So it is a pandemic. So this is the right time and high time to be aware about all these things. If you are not aware right now, it will be late. It will be very late. There will be a lot of burden, the economic burden, and a lot of stresses in our families and in society. So please, so what should be your weight that I talked about? If you are pre-diabetic and diabetic, then what should be the ideal weight that I talked? And how much calorie we should consume in a day? Every person having some basal metabolic rate. Basal metabolic rate. What is basal metabolic rate? This basal metabolic rate, when you are in rest, complete rest, our physiology goes on. We are doing respiration, your heart is beating, your brain is functioning, your kidney is working, your liver is working. Okay, so to perform all these functions, we need some energy. Our body needs some energy. That is called basal metabolic rate. That is the minimum requirement of the body to keep you going. That is called BMR. And for male and female, energy requirement is different. For male, it is weight in kg multiplied by 24. Whatever your weight is multiplied by 24, that should be your ideal BM. That is your BMR. For females, multiplied by 22. Per se, a person who is of 50 kg, what should be his BMR? A male person who is 50 kg, 50 into 24, that will come round 1200 perhaps. If it is 1200, that is BMR, that is the minimum requirement of calorie who goes on his physiology. If the female person, 22, that will come around 50 kg, 1100. He has to consume 1100 and 1200 calorie for male and females. And if you now you have to judge your physical activity. Accordingly, you have to add on further extra calories. If you are moderately physically active, if you are in sedentary lifestyle and you are doing a strenuous physical activity, depending upon that, you have to, that is called activity factor. Extra calorie you can add on. If you are in sedentary lifestyle, like you are doing household work, you are working, you are going to your office and doing work there, nothing extra you are doing, that means you are in sedentary lifestyle. And in sedentary lifestyle, usually we burn out only 370 calories, less than 370 calories in a day. And those persons who are moderately physically active, they burn from 370 to roughly 580 calories to 600 calories in a day. And those persons who are in strenuous physical activity, they burn more than 600 calories in a day. So according to your physical activity, you can add on extra calories in your BMR, basal metabolic rate. We knew how to calculate basal metabolic rate. If anyone is sedentary physically active, you can add 25% to 30% of extra BMR calorie required. But say a person needs 1000 calorie in a basal metabolic rate, you can add 25% to 30%. So 25% it will come 250. So 1250 calories is required only. Okay. If anyone is moderately physically active, he walks 5-7 kilometers every day, do some stretching exercise, do some yoga and pranayama, he can add 35% to 50% extra calories in further. So if anyone's BMR is 1000 calorie, he can add on 500 extra 50%. So 1500 calories required, not more than that. And if anyone is engaged in strenuous physical activity, I'm just talking about the BMR 1000. किसी की ज़्यादा भी हो सकती है. Someone needs 2000 calorie as BMR, depending upon the weight. So weight into, if anyone is weighing 80 kg, he needs 2000 calories roughly. I said for male, it is 24, just I am going with 25 for easy calculation. It will come around 2000 calories if anyone is weighing 80 kg. So depending upon the weight, your BMR will differ. So if anyone is moderately physically active, he can add 50%, 35% to 50% extra calories in his or her BMR. If anyone is engaged in a strenuous physical activity, he can add up to 50 to 100% extra calories in his diet. That is the requirement. If anyone weigh more and he and she has to lose her weight, According to Broca's index, we already knew what should be the ideal weight for a healthy person who want to remain healthy. And those persons who are diabetic or pre-diabetic, what should be his or her ideal weight multiplied by 0.9? That should be plus minus 3. That should be the ideal weight. So if anyone has to lose his weight and he is right now overweight or pre-obese, or in obesity or morbid obesity, and she has to lose her weight. So 1 kg to lose a person 1 kg of his or her weight, he needs to burn 7,800 kilocalorie. 7,800 kilocalorie. So whatever required that already calculated with BMR and activity factor, per se a person needs with activity factor is sedentary, moderately physically active, and strenuous physically active. We have already calculated. Per se, for example, if anyone requires 2000 calorie according to BMR and physical activity, and he has to lose weight. So 500 calorie reduction, whatever required, if we reduce 500 calorie every day, so in a week, he is reducing 4,000 kilocal in 8 days. And what I said, to lose 1 kg of weight, he has to burn or reduce calories 7,800 kilojoule. Just for calculation, consider it is 8,000. So in a week, you are going to reduce 4,000 calorie if you are deducting 500 whatever required. So in 8 days, he or she is going to lose half kg weight. Per se, a person needs 2,000 calorie in a day with BMR and physical activity. Okay. But we are not providing 2,000 calorie. We are reducing out of it. We are reducing by 500. We are providing 1,500 calorie to that person. So in a week, he is going to lose half kg, 500 gram of his weight, half kg weight. And in 2 weeks, he is going to lose, or 16 days, he is going to lose 1 kg weight. So roughly in a month, he is going to lose 2 kg of weight if you are reducing 500 calorie every day. So accordingly, slowly and gradually, we can lose our weight. Most of persons, they are stuck with, sir, मैं weight lose नहीं कर पा रहा हूँ, मैं weight lose नहीं कर पा रही हूँ, what should I do? So nothing you have to do. Whatever you are doing, you do. You have already planned your diet, the calories according to your physical activity. Sir, मैं इतना busy रहता हूँ, मैं तो physical activity कर ही नहीं सकता. I have no time. कुछ मत कर यार, खाना कम कर दे, कैलोरी लेना कम कर दे, वेट कम होना शुरू हो जाए. Okay, so please, we Indians have to remain lean and thin. महात्मा गांधी को देखा, बिल्कुल पतले दुबले बना रहना है, नहीं तो we are going to be diseased like anything. And there is Trahimam all around. And there is no family left who is not taking medicine. Be it Ayurvedic or allopathic or homeopathic or Unani and Siddha, whatever. So please, this is high time to check in. So in brief, I talked about these things. And again, we need a balanced diet. We need carbohydrate, we need protein, we need fat, we need fibers. Recently, I do gastroenterology practice. I came across, and this is known for many years, if a person takes 1,000 calorie in a day, every 1,000 calorie he and she needs 25 gram of fiber. And we are living with fiber deficit diet. You need 25 gram of fiber with every 1,000 calorie. We take grains, And in grains, we take refined grains. We use a polished rice where there's no bran. Bran is used up for rice oil. They are already husked. And if you use wheat, they are already sieved up. That bran is already washed off, and we use a refined flour, that is maida. The most of food stuff are made with this maida. Okay, so there's no fiber in there. We don't use salad in our food. We don't use leafy greens in our food. So we need high fiber diet. Every 1,000 calorie, we need 25 grams of fiber. And what does it do? Fiber, it slows the glucose excursion in your blood. The rapid rise of sugar in your blood, that is making more of sickness. And we Indians, we take carbohydrate-rich diet. So a balanced diet, we need 65% of carbohydrate, 15% of protein, and 20% of fat in our diet we need. So 65% of calorie, it should come from carbohydrate. 15% should come from protein. It comes roughly 80%, and 20% from your fat. And out of these fats, this less than 7% we need saturated fat. Saturated fat, we don't need much. The rest of percentage it should come from unsaturated, monounsaturated, and polyunsaturated fats. So per se, just for calculation, a person, he needs 1,000 calorie every day. So if anyone needs 65% of carb, so 650 calories should be from carbohydrate diet. Just for calculation, just I'm telling you. If anyone takes 1,000 calorie diet in a day, so 650 calories should come from your carbohydrate diet. 150 calories should come from protein diet, and 200 kilocal should come from fat diet. Easy. So now you have to know how much carb I can take in a day. 650 calorie I need from carbohydrate. So how much carbohydrate I should take in a day? We all know 1 gram of carbohydrate gives you 4 kilocalorie energy. 1 gram of protein gives you 4 kilocalorie, and 1 gram of fat gives you 9 kilocalorie. So if anyone needs 650 calorie from carbohydrate divided by 4, that is the carbohydrate in grams required every day. Okay. So 650 divided by 4, it comes 162 gram, 162.5 gram. So 162.5 gram of carbohydrate you can enjoy in a day. It should not be more than that. If you need 150 calorie from protein, so divided by 4, that comes 37.5. So 37.5 gram of protein in a day. For 1,000 calorie, if you are taking 2,000 calorie, it will double. And for fat, so 200 calorie, it is from fat divided by 9, it will come 22 grams. So 22 gram of fat for a person who is taking 1,000 calorie diet. If it is 2,000 calorie, it will come 44.5 gram of protein. Fat, this is about your diet. So how much carb, how much protein, and how much fat, this is the balanced diet. So along with fasting, I covered very important topic regarding a balanced diet and what should be needed how we can prevent our diabetic patients in the management and pre-diabetic patient, and according to physical activity and calorie BMR and activity required calories, how we can lose our weight if you have to put on weight. If you are going to increase your 500 calorie extra, you can put on weight in 8 days, half kg. In 16 days, you can put on 1 kg. If you are increasing 500 calorie extra, whatever required. Take. So this is all. So thank you. Over to Dr. Bharti Bhojwani if you have to say anything else regarding this. And at last, I would like to summarize. Sorry to interrupt, ma'am. At last, I would like to summarize the things. Benefit of fasting. It stimulates growth hormone. It triggers autophagy. It increases your stem cell and undifferentiated stem cells. It stabilizes your blood sugar, and those persons are living with depression and anxiety, they will feel better. It helps in weight loss, improves your metabolic function. It slows your aging process. It is helpful for autoimmune diseases as well. It normalizes your insulin resistant, and it increases your insulin sensitivity. It lowers your blood pressure. Those persons who are suffering with chronic pain, their pain will wane. And person who are having gut issues and candida, things in your gut, that will goes off. And it helps in supporting your hormone, and even fertility issues are get resolved with fasting and change in your diet. It normalizes your ghrelin, and ghrelin is a hormone which regulates your appetite. It reduces your inflammation, and it helps you in preventing oxidative free radical damage. It lowers your triglycerides and normalizes your lipid profile. It increases your memory and your brain function, boosting your brain power by increasing already talked about of BDNF, that is brain derived neurotrophic factor, and it helps in preventing you from carcinomas, cancer, and tumors. So thank you. Over to Dr. Bhojwani.
I sincerely thank you, Dr. Dubey. You have given us so much information. I'm sincerely thankful to you. Sir, I need to ask just a single question if you allow.
Yes, ma'am.
How much I know is during this intermittent fasting, we can only have water. But if by chance we can't control, or there's a severe craving or some issue, then can we have any fruit juice or lemon water during the fasting period?
Lemon water is okay. I would not like to go with fruit juice. Actually, we need fiber. I don't recommend for juicing. Mostly, I ask to eat fruit. They are laden with fiber. Fiber, they decreases glucose excursion in your blood. That slows down the absorption of sugar from the gut into the blood. So should be laden with fiber. And if you have to take juices, please dilute it. Don't take it concentrated. So it is laden with sugar. So it will further increase your blood sugar.
Thank you.
Okay, so lemon water is okay. You can take it's less calories. Even coconut water, it's less. Otherwise, if you are in fasting and you take any sort of calorie, you are breaking your fast. Mind it.
Thank you, doctor. Thank you so much.
Thank you. Can we end our session, or if there is any confusion regarding what I talked of, we can discuss. Otherwise, we can take off.
Sir, I wanted to know only whatever you are told the calories per person to take 1200. So can you define in some food form? So we cannot calculate each and everything what we are eating and how much calories are there. So if you define it in whatever in 8 hours, what we have to eat and how do we have to start the day.
Sir,
So we can
everything is there. Everything is there on Google. Whatever you eat, the calorie content, everything is on the Google. You can search whatever you eat, how much calories is there, how much fat, how much fiber, everything is written on the Google. You can go for searching it. But to start your day, one should, if anyone is normal lifestyle and if he or she takes cooked meat, I would like to say before 12, you go with raw food. Before 12, in your breakfast, you take fruit and salad all together mixed. Fruit and salad, not fruit only. If you are taking salads, they are low in calories, they are laden with fiber, they will slow down the absorption of glucose in the gut. Okay. So before 12, you can go with raw food. And after 12, if you are taking cooked meal, I would like to go with the whole grains, like with fiber. And if you are taking, and better to go with millets, they are rich in fiber, rich in nutrients. Okay, so millets you can take with some cooked dal, and oil should be very less. Whatever we need fat, we are consuming much fat than what what our body needs. So that you can take and have plate full of salad. Further here, salad is going to, and fiber is very important for your bowel movement, preventing your constipation. Most of us, we are having constipation, and there is, if you are constipated, you are holding toxins in your gut that percolate into in your gut and that percolate into the system, and that causes a lot of health issues. So fiber is needed. So have plate full of salad before taking grains and green leafy vegetables that you can take. And by evening, please finish your dinner as early as possible between 6 to 8. And depending upon your lifestyle, please finish it earliest possible time. Since whatever says your there is a secretion of insulin in our body. That is one is basal, which maintain your blood sugar around the clock, and there is bolus. Whenever we eat, whenever we take any calories, there is kicking off of the insulin. That is the short-acting insulin spots that comes on, and with each meal we are kicking our pancreas to secrete insulin. And the short acting insulin releasing time is between 12 to 6, according to our human physiology. So the older practice of taking meal before or around sunset, that was a good practice in our India. With our globalization, we are getting, and civilization we are living in. So civilized society. So round the clock, we are getting food in the Swiggies and Zomato. So anytime we take meal, we are going on parties and night parties, night clubs. So just we are breaking our circadian rhythm. We are not matching our circadian rhythm, the body's physiology. That's why we are getting sick. So please, last day I was in a CME program. The time was starting 8, and I reached there having my finished dinner. I went there. I didn't eat anything there. I finished my dinner by 7:30. I reached there. I enjoyed my knowledge, whatever CMA was going on, but I didn't eat anything. So you have to discipline yourself, and please engage yourself in physical activity. Physical activity increases your, already talked this growth hormone, maintains your bones and muscle health. Bones and muscle health. You might have heard Milkha Singh, and he was healthy in 90s too. He used to run every day. He didn't took any medicine till his last breath. Okay, so engage yourself in physical activity.
Sir, does it make a difference whether we go for morning walk or night walk?
Any time of the day, anytime when you have time, you can walk. Just keep in mind, just after food, you should not go for walk. Just after food, you can take half an hour. After half an hour, you can go for walk.
Thank
Between 15 to half an hour. Better to go after half an hour. You can go for walk. This walk is going to improve your whatever we eat, and doctors, physician, and endocrinologist, what they say. Go for blood sugar check 2 hour your food. Fasting and 2 hour PP, that is postprandial 2 hour. So if you walk, what does happens? Your skeletal muscles use up the sugar, whatever in the blood. So 2 hour excursion, the sugar that will lessen. So you are making yourself euglycemic. This advanced glycosylated product, they will be formed less. So you are reducing the chances of complications, the diabetes or high blood sugar related complications. Even for a normal healthy person, it is better to go for walk for not more than 10 minutes. So after every meal, it's a heavy meal. That is the lunch and dinner. Use this practice for 10-minute walk, not more than 10 minutes. It suffices your requirement.
So next question is Hansa ji.
Ma'am, you
Hansa
are
ji,
on mute.
please unmute.
Yeah, namaste, sir. Now you can hear me?
Yes.
Hello?
Yes.
Yeah. But somebody has a osteoporosis in a knee, can cure by autophagy, fasting, and for the intermediate, or otherwise she have to be take a medicine and all this.
In knee, the common disease is osteoarthritis. Osteoarthritis.
Yes.
Okay.
Yes.
So osteoarthritis, yes, with fasting and this all, you can heal your osteoarthritis problem. Intermittent
Okay.
fasting and fasting fortnightly and all, you can be pain-free.
So first she have to be start 24 hours one day or 3 days, and then she go for the intermediate fasting.
It is better to practice 14 or 16 hours every day, and once in a
Okay.
week or fortnightly you can go for increasing 24 to 36 hours or 48 hours.
Okay.
Ideal to go with 48 hours, not more than that I will suggest. Okay, that reduces lot of inflammatory markers, that reduces your pain.
Okay. Thank you. That's what I want to ask.
Thank you.
Thank you so much. Really appreciate it.
Sir, there's a
Understood.
question, sir. So there's a question that after 24 hours of fast, what food should we break the fast with?
Yes, you can go with coconut water or you can go with lemon water. Your digestive tract that seizes, it is not going to digest heavy food. You will feel bloated. So just ignite your the digestive fire with low calories and liquid diet, like diluted fruit juice, diluted, or coconut water or lemon water. It's better to break your fast with that. And slowly and gradually you increase on other food. Then you start with pulpy fruit, then juicy fruit, then pulpy fruits or salad that you like.
Sir, can we
So
also
don't-
start with green juice?
Yes, sure. Diluted green juice again, they're laden with fiber that should be sieved, that must be strained, and you can take even break your fast with green juice as well. With little quantity, not more than 200, 300 ml. Take it by sip and sip. Don't gulp in one go. And we are meeting on further tomorrow if time permits. Otherwise, we will take one session next week. I have one CME program tomorrow. If time is permitting me, I will take session.
Sir, I have just last question. I mean, because these are like dental team and all here, so I just want to ask a question that those people who are on the raw journey and then raw diet and fruit diet, तो उनको बोला जाता है कि मतलब कुछ लोग कहते हैं कि ब्रश नहीं करना चाहिए, बिल्कुल लाइफ ऐसे जियो जैसे जानवर लोग जीते हैं, उनको कभी ब्रश की जरूरत नहीं पड़ती है. तो मुझे ये पूछना था क्या कि हम ह्यूमंस को भी क्या ऐसा जरूरी है कि हम जब रॉ डाइट पे हों तो हमारे दांत को ये सब की जरूरत नहीं पड़ेगी ब्रशिंग की,
No,
क्योंकि
ma'am, it
जो
is
हम
not
लोग
like that.
टूथपेस्ट यूज करते हैं उससे दांत और खराब हो जाते हैं।
यहाँ पर तो
I
the
would like to
better
answer
that
the
Dr.
question.
Bhojwani will answer this. ऐसे तो
Yes.
मुझे ये कहना है कि जानवर लोग तो पॉटी भी साफ नहीं करते हैं, तो अपने लोगों को भी पॉटी साफ नहीं करनी है, बस पॉटी क्या निकल जाओ। जानवर तो पॉटी भी साफ नहीं करते हैं, दे डू डंग टक 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 एंड दे गो, दे डोंट वॉश देयर एनल कैनाल ऑन ऑल। तो अपने को भी वो नहीं करना है, वी शुड नॉट डू लाइक दैट, शुड बी okay. So if you are holding on the foods in your interdental spaces, you are going to increase your bacteria in the oral cavity and you are going to damage your teeth and gums. Oral hygiene. So you have to keep your oral hygiene good. And we, as a physician, I know if your oral hygiene is poor, just I know there are many diseases can come up, but one, the risk of endocarditis is very high. Those persons who are having this poor oral hygiene. So over to Dr. Anup Saran to Bhojwani to give light on this question.
Sure, sir. Actually, this is a very, very nice question asked by Mrs. Parul Chandel. Okay, so there have been studies conducted. Initially, there were studies. The name of the study was Turku study, and there were many groups of studies wherein certain amount of people were put on completely raw diet, complete raw diet. So what they found is the number of caries जो दांत में ब्लैक कलर का कीड़ा लगता है ना, was significantly reduced, or almost 2 out of 10. The percentage exactly I don't remember, but the percentage was nil compared to those people who were put on sugar group, chocolate group, cooked food group. So of course there is significant amount of reduction in getting dental caries those who are having raw food, but of course you need to brush. So I always say brush in the morning brush at night to keep your teeth, brush in the morning to keep your friends. So at night, no one is brushing. You have to brush at night, maintain oral hygiene. If you're brushing at night, entire night that kachra is gone outside your mouth, and otherwise the stay in your mouth will lead to caries and something or the other. So maintain your oral hygiene. Okay. Thank you, Dr. Dubey sir. Very nice session. I'll also start fasting and raw diet. I've been a vegan since past 1.5 months, and I'm feeling very, very energetic. And you also start feeling good when you do this karma-less diet and no to animal cruelty.
I would
Thank you,
just
sir.
like to add one thing, Dr. Anup. Brushing is a must both the times. In fact, sometimes in the afternoon also, I myself, afternoon also after lunch, whether it is only salads or something, I just move the brush. I don't use the paste in the afternoon. The main thing is, what people do is when they are brushing, they don't know the right type of brush which they have to use, the right paste they don't know, and the way they brush. So my request is you should visit a dentist at least once, and according to your age. See, brushes vary right from 2 years of age to 90 years of age. But I have seen कि चलो my dad का दांत में दर्द सेंसोडाइन से गया तो मैं भी वही यूज कर रहा हूँ, ऐसा नहीं है. But brushing is a must.
Thank you.
तो वो जो
Dr.
उसमें बोलते हैं कि क्लोरीन जो पड़ता है, जो भी मतलब केमिकल जो उसमें टूथपेस्ट में पड़ता है, वो दांतों को और कमजोर कर देता है। तो जैसे आपने बोला कि अकॉर्डिंग टू एज हमें टूथपेस्ट भी चेंज करना चाहिए, तो क्या हम जो बच्चों का जो टूथपेस्ट होता है आजकल जो आ रहा है बिना उसके केमिकल के, तो हम वो यूज कर सकते हैं क्या?
नहीं. See, बच्चों के लिए जो पेस्ट है वो बिल्कुल अलग है. The contents are different from what are the contents in a normal paste. And अगर आप Google करेंगे ना तो you will get all the contents कि एक normal toothpaste में क्या content होने चाहिए. So and more than a toothpaste we are just going to take एक pea size. Main is the brushing technique, how to do. And you just now said that fluoride in the paste will harm teeth. No, not at all. Why will fluoride harm teeth? It depends on the part ppm. 500 ppm है कि 1000 ppm है. And जो adults हैं उनके लिए fluoride कभी भी नहीं recommend करते हैं. For an adult, Colgate Total toothpaste is a good one if you just want to know the ingredients. I'm not saying other pastes are not good. You can go in. I can't say that Lux is good and Pierce is not good. That is personal choice, whichever toothpaste you like. But the contents in the toothpaste will harm teeth. That is not at all right. The technique can harm. You know, some people जैसे वो टाइल ब्रश कर रहे हैं ना, टाइल को साफ करते हैं, जोर जोर से करेंगे. They will use hard brush, medium brush, and they will brush for 15 minutes. That technique will harm the teeth. You're supposed to brush your teeth maximum for 3 minutes in a medium pressure, as if you're not cleaning your tiles, bathroom tiles. You're cleaning your pearls. These are 32 pearls given to us by God. How do you clean your diamond jewelry? How do you clean your pearls? वो value देके you clean it with a soft toothbrush. Nowadays, even medium brushes are banned worldwide. Like I only recommend soft. There are studies, soft toothbrush to be given right from the age of 10 years. And 10 ke below to only kid brush. And ultra soft after the age of 50, 55, depending on the condition. And main thing, please never brush horizontally. See, people say brush kiya, daant sad gaye, attrition ho gaya, cavities ho gaya, and they don't listen. Never brush horizontally. You will not get cavities in the cervical area. वो cervical area बहुत delicate है. For the upper teeth, you're supposed to brush downwards. For the lower, upwards. Then you will not get cavities in that area. They put all the blame on lemon. I'm not saying lemon will not cause cavities. ऐसा नहीं है. लेकिन लेमन को अगर हम डाइल्यूट करके लेते हैं तो कोई कैविटी नहीं होगा. बट देयर आर फ्यू पीपल वो लेमन में सॉल्ट डाल के दांत को उससे क्लीन करते हैं. सो दैट इज एसिडिक, दैट इज गोइंग टू गिव कैविटीज. सो ब्रशिंग इज अ मस्ट, शुड बी ब्रश्ड इन अ प्रॉपर ब्रशिंग टेक्निक, एंड अ सॉफ्ट ब्रश इज ऑलवेज recommended. Spend little money on brush, buy a Oral-B brush. Again, you know, people do what? वो vibratory brush use करते हैं, motion wala, 1000 rupees, 2000 rupees. Let me be honest, those brushes, I hope company wale mere se naraz nahi ho, but those brushes were ideal for a person जिसके हाथ में fracture हुआ है, या कोई handicapped है, या old age में, you know, paralysis है. So those brushes were for them. लेकिन these rich people started giving to their children as a job, you know, fun कि इससे करो, and then it has become marketing that people are using vibratory brush. I don't recommend. I don't use it. A normal Oral-B or Colgate soft toothbrush is excellent. And please change it every 2 months. You know what people do? 6 महीने तक सारे bristles ऐसे हो गए हैं, they are using it. Then they will say brushing is wrong. And kids के लिए toothbrush should be changed every month. Okay, thank you.
Thank you, ma'am, for giving a very precise knowledge about brushing, and thank you, Parul, for raising this question on this platform. And for our at the end, I would like to thank IDA Mumbai, who has invited me to talk on this topic and spread my the knowledge what I have required for the humanity and mankind, the right knowledge which goes to the people. So thank you, and heartfelt gratitude to IDA Mumbai, who has invited. I would like to come again and again if you people invite me for further any other information regarding health and
Sure, sir.
Of course, sir, it will be an honor.
Thank you.
Sure, sir. I'll always invite you. Thank you.
Thank you, sir.
In session. Sukriti ji, can we in
Yes,
session?
sir.
Okay.
Yes, sir.
Thank you. Thank you all.
Thank you, sir. Thank you, ma'am.
Thank you, sir. Thank you, ma'am. Thank you, everyone.
Thank you.